Intake and output record or flow sheet. Here you would document all of your patient's intake and output. You will simply click on this flow sheet on the left-hand side, find the gray tab, right-click, choose Add Single Time Column, make sure the date and the time are appropriate. Access the flow sheet through the Quick Launch Docs or the Flow Sheet tab. You will single-click on the intake and output record. Right-click, Add Single Time Column, and ensure you have the correct date and time. This flow sheet is our only flow sheet that will auto-calculate any MLs and tally throughout shift and daily totals. In the top of the flow sheet, the first 3 rows you will never document in, and you will never document in the yellow or the green columns, only the white column that you add. Scrolling through this flow sheet, you will see that it pulls in from your orders, so any IVs, drips, or IV piggybacks. You'll be able to calculate all of your drips over your shift, calculate your intake for your patient's oral intake. We do meal percentages on the quarter, 25, 50, 75, or 100. You will document the patient's feeding and any output for the patient. Documentation to the intake and output record. Follow your policies and your standards of care for your designated area. After you've added your time column, simply document in the field in which you need to tally up your intake. For our ED RNs, please document in your ED IV fluids infused once the patient has been admitted to any unit. You will add a single time column prior to their admission and enter the total amount they received in the emergency room. For all other inpatient areas, you will document to your IV rates, your continuous infusions, your IV piggybacks, any oral intake, or output of any kind. You will want to do this in real time, as close to real time as possible. Your CNAs may document to this flow sheet as you delegate. It is important to document as frequently as you can, adhering to your standards of care so that we have an appropriate and accurate tally of the patient's intake and output over their stay. You will notice that most of the fields are simple data entry. Ensure that after you have added all of the necessary information that you hit the Save key on the far right. Your documentation will remain italicized until you save it. You will note all of your data that will calculate towards the top of this flow sheet over the course of your patient's stay based on all of the data that you've entered. If at any point you don't see a parameter that you need to document to, such as lines, drains, blood products, any other type of oral intake, or output, you can add that into your patient's flow sheet. These parameters are not added automatically. You will use a right-click function, choose Add Parameter, and then go ahead and add what you need to and choose OK. This will allow you to document an appropriate intake and output for your patient. Don't forget to save your data once you've entered it.